Hi, I'm Dr. John O'Taves. I grew up here in Colorado Springs, and I have a passion for helping patients with headaches and migraines. I started Novera Headache Center earlier this year because I wanted a place that's specific to the patient with headaches and migraines. This desire to help patients with headaches and migraines started early on in my career. I had a patient, she was a middle-aged woman, came into the clinic after dealing with migraines for years. She'd tried medication, she'd been to multiple providers, and had just started to give up hope. During that session, I provided her with an evaluation that assessed the neck, which no one had looked at before. It provided her with an understanding of what should be done and a treatment plan that can provide hope. And during that session, she broke down because it was so much for her to handle, and then so encouraging to have someone come alongside her and provide her with something that hadn't been looked at yet. That moment and that type of situation is something that has inspired me to go down this road of being the migraine and headache specialist in Colorado Springs. I want to tell a different story, one that provides hope to patients that have gone through medications and multiple providers and haven't found the answer they're looking for. Let me explain a little bit about migraines and headaches and how our approach can really add value to a patient that experiences these things. So just like the lady I told you about, most patients with migraines will not have an objective finding on their MRI or CT scan or X-ray. So it's a diagnosis that's based off of your symptoms, which is more of a subjective way of making the diagnosis. So when patients come in, we provide them with a more objective exam. We look at how things move in the neck, and we specifically break it down into each joint and what that joint should be doing. If it's not doing the movement it should, then we can explain a reason for pain to be sent to the brain. But the tricky thing is, when that pain signal is sent to the brain, oftentimes it's confused as pain behind the eye or pain in this sort of pattern. It can even be confused as nausea, sensitivity to lights or sounds, and visual disturbances. So all these things that migraine patients go through. Being able to evaluate the neck and restrictions in movement, and then explain, okay, this could be the answer for all of your symptoms. We can also take it a step further and say, okay, we have a plan in place to improve how your neck moves, reduce the symptoms that you're feeling, and hopefully get you to the point where you are on your own and back to the things that you love in your life. So our process is it's hands-on, so we call it manual therapy, and it's one-on-one in a treatment room that caters to the patient with headaches and migraines. And over the course of 6 to 8 weeks, we can restore movement in these segments of the neck that aren't moving well. And those segments not moving well, like I said earlier, can be the reason for your symptoms. So we have life-changing moments when patients come in with headaches and migraines. And I am so passionate about it because I love those moments. The moments where someone realizes that they don't just have to stop telling people about their pain because they think it's just going to be there. Oftentimes patients with migraines, they feel ashamed that they have this burden that they can't share because there's not necessarily hope. And so when their migraine comes, they just have to push through. So I love saying, hey, we can handle this. We can take you and evaluate your neck and then provide you with a solution that can allow you to get back to the things you love. If this sounds like you, we have an initial evaluation or a free discovery visit that you can schedule right on our website and get going today. Thank you for watching. I hope that we can change the way Colorado Springs views headaches and migraines.